This is the radius, and this bone is a long tubular bone composed of the shaft or the body and then two epiphyses, the proximal and distal epiphyses. Now this bone in the forearm is placed or is situated laterally, and then it has the head of radius or caput radii. On the head, it has the articular facet, or the fovea articularis. Now this facet articulates with the conda of the humerus. It also has the articular circumference, circumferentia articularis. It's located beside the head of the radius. And this articular circumference articulates with the ulna. They articulate with the ulna. And this is the neck of radius or column radii, just located below the head of the radius. It also has the radial tuberositas radii, which resides below the neck on the anterior medial surface of the bone. Now let's talk of the distal epiphysis. This is the distal epiphysis. And this distal epiphysis has got some structures. Below it here is the carpal articular surface or fascis articularis carpalis. And this surface articulates to the carpals. Good. And this long process we are seeing over here is the styloid process or the radial styloid process, processus styloideus. It's always at the lateral border of the distal epiphysis. And on the other side, or on the medial border, we can see a notch known as the ulnar notch, incisura ulnaris. Incisura ulnaris. And there's one more important thing you have to know, which is the foramen nutrica. The foramen nutrica. That's where the bone gets nutrition, through this foramen nutrica. Now the radius has some surfaces and also some borders. Let's consider these surfaces and borders. Now a surface is a flat part of the bone, whilst a border is actually a sharp protrusion on the bone. So looking at this bone, this flat part of the bone is the anterior surface, fascis anterior. And that makes the other side fascis posterior. And then here becomes the lateral surface, fascis lateralis. It's so called because it is facing the lateral side of the body. So let's now consider the borders of the radius. The radius has the anterior border. This very sharp protrusion is the anterior border or margo anterior, and that makes the other sharp protrusion the posterior border or margo posterior. And this sharp elevation, which is located medially, is called the interosseous border or margo interosseous. It is located medially. How do we know if a radius or a radial bone is left or right? This bone we are seeing is the left radius. How do we know that? Always the foramen nutrica should be at the anterior side, and also the stylet process of the radius should be at the lateral side. So in this manner, we can easily put it at the anatomical position, and that makes us know if it's left or right.